my talk is going to be a little bit more theoretical, but I have some concrete examples, so if at any time afterwards you want to talk to me or something was unclear, I'll be happy to discuss this. Also, if you feel like you want to stretch, you want to move, you want to leave, that's perfectly fine. Also, just a short note that there will be some stuff in the slides that is offensive, it's transphobic, it's misogynistic, and it's racist, so I just want to let you know. So the first picture on this slide is from the Eugenic Records Office in Long Island in New York. It's from the 1920s, so this was during the eugenic era where all these records were collected of people's, genetic traits, different kinds of physical measurements, all kinds of things that they collected. And the one below is the NSA headquarters in Maryland. So it's just sort of, I'm not saying that it's the same thing, but I'm sort of like, what I'm going towards is thinking about this like data collection in our current situation and how eugenics has transformed. I want to introduce some concepts first. So this is the theoretical part, but I try to be as clear as possible. So basically, I want to introduce the concept of biopolitics. So it's from Michel Foucault's philosophy. Some of you are familiar with this, and some might not be. So basically, it's a form of power that operates on the level of life. So it's power that controls our lives, fertility, the way we sleep, the way we eat, population control, basically. But what I find interesting is that there's one section in Marx Capital, Volume 1, if you ever want to look at that book, chapter 10, it's called The Working Day. So he talks about how the working day has been controlled and split into time units. So suddenly, because of industrialization, we start looking at the working day and our temporalities in terms of these units, and we have to perform certain kinds of tasks within certain hours. And so Foucault picks up on this in Discipline and Punish, and he talks about the school schedule, the military, and all these different kinds of time schedules that arrange and control us. And then we internalize them, and then we become productive, and we want to do more and more things in certain amounts of time. So I'm talking about power over trans-temporality, and I use trans very broadly. I follow Ruth first, I'll come to that soon, and how it operates both at the level of the subject and the population. So our temporalities are being controlled both as individual subjects and as groups. And so one thing is disciplinary power over temporality. So in the context of, for example, trans-specific healthcare, indefinite waiting and being caught in a temporal standstill are constitutive of disciplinary power over transgender temporality. And this is in Ruth's book, chapter 5, excellent chapter. I suggest you take a look at this if you're interested in this. And you can compare this to the Reagan administration's refusal of HIV/AIDS-related healthcare to gay men. And this has been addressed in queer theory by thinkers such as Leo Bersani and Lee Edelman. So it's a bureaucratic time as a form of power. I'll come to this later, but I think a lot of the things that we have addressed here actually has to do with this kind of bureaucratic control of time. One thing is when you have to go through an adoption process in order to, I for example had to adopt, my baby is now 7 months, so my partner gave birth to our child, but I had to adopt them because I couldn't get my gender marker changed without agreeing to be surgically sterilized. So there's again one form of bureaucratic time, waiting, that controls what I can do with my life. So the other thing is biopolitical control over future. So I'm thinking that sterilization as well as suspension of assisted reproductive technologies are a form of biopower over the population and operates through an intervention into reproductive future. So here, for example, in the talk we just heard, certain kinds of suggestions and recommendations are actually intervening with how you can plan your future. So, and there's again the time, 2 years, 5 years, 1 year, how do we plan our futures, what are our options? So the power intrudes into our temporality again. So this is sort of the theoretical part of this. So one specific case, concrete case that I've done research on in my own research is the sterilization clause in the Swedish Trans Act of 1972. And I argue that previous scholarly research on the history of eugenics has systematically ignored the question of transgender sterilization. So this hasn't been seen as a form of population control. It's been more seen as a form of voluntary sterilization, and I'll come to that. So for example, in his extensive government report on sterilizations in Sweden during 1935-75, Mateus, for instance, mentions the sterilization of trans persons, but then quickly concludes that in general, medical gender reassignment leads to infertility and is hence a voluntary form of sterilization. So this comes already from the 60s and 70s when they made the first legal act in the world to actually legalize certain medical treatments for trans persons. So I'm not saying that this is the same as eugenics, I'm just saying that there's a parallel between these forms of population control. So early clinical cases from the 1950s and 70s show repeated skillful attempts at self-narrating a coherent life story within a context of social norms that do not recognize trans lives and bodies as intelligible and livable in the first place. So I'm looking at this as a form of, somebody was earlier talking about labor, so just the narrating and trying to make yourself intelligible to the medical experts who cannot even understand anything about what you are. That's already a form of agency that appears here. But then what's interesting is, so Jan Wolinder is a person who made his doctoral dissertation, one of the first ones in Sweden on trans persons. So in his research, we find that there's some patients who refuse to do these draw a person test and IQ tests because they said that this is silly. This has nothing to do with what they wanted to achieve. And so he just sort of ignored them and said that this is what we have to do when we do research, that some of these results I had to ignore. But he doesn't see them as a form of resistance. And so he diagnosed 50% of the trans women that were his patients as psycho-infantile. So when they wouldn't do the task they were given, he just saw that this was a form of a mental disability. So here's where I think it's interesting to think about time and temporality. I think that in these cases, trans lives are sort of a form of a non-normative. They're non-normative temporalities. So they're unintelligible to mainstream society and medical experts because the stories of personal journeys and transitionings do not fit with heteronormative and cisnormative regimes of temporality and the ideal of the complete autonomous subject of liberalism. So here's the thing, like all of many of these stories tell in one way or the other about journeys, and there's a temporal dimension in that it doesn't fit to someone who thinks that in order for you to be a stable citizen, you have to be sort of solid. Temporality is linear, but you are sort of an autonomous and individual subject instead of, for example, thinking about relationality. And so there's the counterpower. So when power operates over you, you always can also think about how, in what terms can counterpower work. So how do these people resist? And here's where, so time hacking, if you Google it, you'll find all kinds of stuff. So this is not a new term, right? And this is not an academic term. I just use it as a metaphor here. So I'm thinking about this as an attempt to alternate hegemonic logics of time in dominant society. So for instance, the heteronormative family institution, to think about that as a temporal phenomenon or unit. Or then capitalist accumulation and progress. So if you think about today, for example, the endless amount of hours and productivity that we just have to improve and do more and more and surveil ourselves more in order to be more productive. So we can think about that again through temporality. So it's a mode of practice that sets the subject in a question in relation to those techniques of power that produce, circulate, maintain, and regulate regimes of truth and norms about gender, sexuality, kinship, family, and reproduction. So hacking is not the same as cracking. So this is not science fiction. So I'm not thinking that we can time travel. I'm just thinking that if we can sort of hack into these norms about temporality that have been imposed on us, then we can do something with that. And I'll show you soon some examples of how that has already been done in queer theory. And I also follow Susan Stryker's work on trans history here. So one question, of course, is also, can we think about transmasculine reproductive labor, intimate labor, and care work as an intervention into heteropatriarchal time? So men's care work, men's intimate labor, giving birth and caring for children, chest feeding, that is something that can be quite subversive in this framework of what we usually think about how families should work and how, I mean, this is basic just, you know, history of feminism and feminist critique of some of these structures. Okay, so how has this already been done, this kind of resistance to heteronormativity? So one thing to look at is the literature that was written during and after the AIDS crisis, 1980s and 90s in the US. In these texts, most of the time, subversive temporality is opposed to linear progressive conceptions of temporality that center on heterosexual reproduction and family building. So one book to look at is Lee Edelman's No Future, Queer Theory and the Death Drive. Another one is Jack Halberstam's In a Queer Time and Place, Transgender Bodies and Subcultural Lives. Then there's Jean Hartamore's Queer Necropolitics, which defines necropolitics as the power over who deserves to live and how certain lives must die. In all of these works, pretty much, queer temporality is generally centered on a normative conception of anti-utopianism. So time is conceptualized through anti-futurism, anti-utopianism, anti-reproductivity, anti-heteronormativity. And there's lots of work on the ideals of cruising and subversive urban subcultures. And again, we have to understand the context of Reagan's administration and why US academic queer theorists were writing this kind of literature. And I'm trying to think about Lee Edelman's critique of heteronormative time, so Lee Edelman's cultural critique against this man. And it's an example of queer time hacking. So what he's trying to do is actually reverse our whole understanding of heteronormative production and temporality. Because what is life other than living in time? So here's some quotes. So he says, what is queerest about us, queerest within us, and queerest despite us, is this willingness to insist intransitively, to insist that the future stops here. And what does he mean? Well, if you look at an earlier book by him, I have a lengthy quote, I'll read it. If you can't see the small text, I'll read it. So he says, choosing to stand, as many of us do, outside the cycles of reproduction, choosing to stand as we do by the side of those living and dying each day with the complications of AIDS, we know the depiction of the societal lie that endlessly looks towards a future whose promise is always a day away. We can tell ourselves that with patience, with work, with generous contributions to lobbying groups, or generous participation in activist groups, or general doses of political savvy and electoral sophistication, the future will hold a place for us, a place at the political table that won't have to come, as it were, at the cost of our place in the bed, or the bar, or the baths. But there are no queers in that future, as there can be no future for queers. So this was written in 1998. And what he means by this is that if we sort of buy into this heteronormative conspiracy, and we become domesticated good queers, then in the future, we're actually, once we get there, we're no longer queer. And so he's saying that basically to resist having children, to resist reproducing is a form of subversive queer politics. And he writes a lot about subversive, gay sex as subversive. And we have to understand again this in the context of the AIDS crisis and what Reagan was doing during these times. But then there's a very good critique of Edelman's attempt to sort of change the logic of how we think about future. And this comes from Jose Munoz. So here's the ideal of what a family should look like and what gayness should look like. And so I'll read again a quote from Munoz. So he responds to Edelman and he says, all children are not the privileged white babies to whom contemporary society caters. Theories of queer temporality that fail to factor in the relational relevance of race and class merely reproduce a crypto-universal white gay man that is weirdly atemporal, which is to say a subject whose time is restricted and restricting hollowed out present, free of the need for the challenge of imagining a futurity that exists beyond the self of the here and now. And here I'm thinking, for example, this sort of fits beautifully into what Thomas was speaking about yesterday and how people were responding to pictures of him being pregnant, that when we can imagine something differently, then we can sort of also live our lives in different ways and resist norms. So this is from Cruising Utopia, the then and there of queer futurity. And this could also be looked at through Alison Capper's notion of grip time in feminist queer grip. There's lots of literature on disability time, which I think is really beautiful. It sort of critiques Edelman's blind spots. But what about transfuturity? What about trans time? There's not as much literature on that as there is on queer time, and a lot of the queer temporality stuff centers on sexuality. Both of these works try to alternate the logic of time underlying not only heteronormativity but also racism and ableism. So I think that the challenge for queer politics or trans politics is not the rejection of reproductive futures, but instead asking how and why certain lives are destined to no future based on what capacities they can and cannot regenerate. So it's not about choosing, like, who has the privilege to choose, can you reproduce or can you not, like Edelman was critiquing in his work, but asking who are allowed to reproduce and who has access, for example, to these different kinds of healthcare services. And if you're interested in literature, this is sort of a snapshot of a lot of different stuff, but here's some further reading. So definitely Ruth's book, Understanding Trans Health. And then The Emergence of Trans, if you're interested in eugenics, there's one chapter that I've written. And then another one in this book called Interdisciplinary Perspectives on Shame, so that's more about disability time. And then there's one article coming up in Bodily Interventions and Intimate Labor, and that's specifically about the Swedish case of these early case files. Thank you.